Hi, my name is Dr. C. I'm one of the GPs in the UK. I thought of thinking doing this series to explain people about day-to-day conditions. I see that a lot of people do Googling and a lot of people do look at niche things like research and all of that. But what I see from day-to-day patients is that they don't have much of an understanding about the basics of a certain illness. So I thought I'll start doing this series, and I will be doing daily recordings. And if if you do need a certain topic to be covered, do comment below, and I will try to get to that. Today we're focusing on polycystic ovarian syndrome. So PCOS, a lot of people talk about infertility, losing weight, and all of those things. But two things I think a lot of people don't look into and miss discussing about is the fact that the cancer risk and the cardiovascular risk. So I'm trying to keep these recordings very short so that it's easy to understand, easy to grasp. So here it goes. So polycystic ovarian syndrome, PCOS, happens, you know, that you menstruate less amounts per year. So what happens is that when you menstruate less, menstruation means that the womb lining is broken down and you shed that in your menstrual cycle. But when this does not happen, your womb lining becomes thicker and thicker, and that increases the risk of having cancer in the womb lining, which we call endometrial cancer. So it is very important that you have menstruation every 3 to 4 months. So if this does not happen, you need to have a chat with your GP or your doctor and make sure that we medically induce that your cycles every 3 to 4 months. This would reduce the risk of endometrial cancer, because it has been shown that with PCOS there's about 2 to 6 fold increase of endometrial cancer for patients. That's number one. Number two is the cardiovascular risk. Polycystic ovarian syndrome, PCOS, is not only affecting your ovaries, it does affect your whole body. So that means it is a metabolic problem. The other problem that you have with PCOS is the insulin resistance. So it's like a diabetes situation. The insulin resistance combined with other metabolic problems, which not fully explained so far, has increased the risk of cardiovascular risk going forward. I think a lot of people focus on infertility, trying to lose weight. That's really great. But there is a risk of cardiovascular that is affecting your heart and your blood vessels going forward, which is more important for your survival than your fertility. So it is important to lose weight and regulate your metabolism. And one might say, okay, losing weight is the most difficult thing that I can do with PCOS, but you need to have a chat with your doctor, and you might not get away with it from one month, because I had patients who were coming in and saying, oh, I walk for 10,000 steps and I do diet a little bit, but I can't shift my weight. With polycystic ovarian syndrome, PCOS, it's very difficult with just risk to your heart and your blood vessels, with blood pressure, heart attacks, and that kind of things. So you need to focus more on that and try to get your metabolism in control. That is important. So let me know what your thoughts are. If you do have any questions, comment below and I will try to get to it. Thank you.